Hey, thanks for joining me. So today I want to work through something that, or a couple different thoughts have been coming together that I've been thinking about. I'm not sure which one is going to end up the dominant theme of this video. So I've got a couple in mind, and we'll see what ends up being the main thing. So the first thing, and I think I did a video about this a week or two ago, is this whole concept of things that work, even if we don't understand why. Okay, really windy all of a sudden. Okay. So there are a lot of acupuncture points along the inner shin that are very good for period cramps. Period pain. Objectively, they definitely work. And I can bring many friends, family, and patients of mine to tell you that. And in Chinese medicine, we understand how they work because they affect the spleen meridian. The spleen meridian is responsible for a lot of things to do with blood flow and hormones. And so when we release the stagnation of the spleen meridian, then we can affect all sorts of things to do with the menstrual cycle, but specifically with the uterus. Okay, less about the effects of the hormones systemically on the body. So if you have backache, headache, nausea, your boobs swell, and hurt, there's all sorts of symptoms that are more systemic. Those are not necessarily connected to the spleen, but the pain in the, specifically the cramps and issues with the uterus, very much spleen meridian. We release that tension and we can improve the cramping, the pain, whatever the case may be. Okay, so that's thing one. But I haven't had a good explanation up until now for how that works in an anatomical, physiological sense. A lot of things with Chinese medicine, for example, there's points near the knee that release the shoulder. Okay, ta-da. Sorry about that. Apparently there's a snake somewhere in the area. Totally lost my train of thought. Okay. So there's a lot of things that when people ask me, why are you doing this point for that? I know how to explain. Why are you doing this point by my knee in order to treat pain in the opposite shoulder? Because when the knee is all tight, then that affects the hip, and the hip affects the shoulder, and the whole square of the torso. And I have an explanation that I don't know if this is actually literally exactly how it works, but it makes sense in terms of the language that they understand. And there's things that might not have made obvious sense to people, but that have been researched enough that I can say, look, I can't explain to you why in terms of physiology, putting needles in this spot in your leg lowers inflammation in the body, but I know that it's been tested. I know that at Harvard and Stanford, they've been doing research and concluded that if you stimulate specific points in the legs and arms, it lowers inflammation. If you stimulate points in the belly, then it increases inflammation, if that's something you want to do, and sometimes that is something you want to do because inflammation is part of the body's natural healing process. And then there's things that I have no explanation for. Up until now, I've not been able to tell you why points on the inner shin affect the uterus in anatomical language. Again, in Chinese medicine, I know why it works, and that's why I use them. So I was reading this article by Kathy Bowman, who I highly recommend looking into if you have any interest in health, anatomy, physiology, pain, longevity, women's health. Just basically look her up. If you're watching me, you should look her up. Kathy Bowman, her podcast, and one of her books are Move Your DNA. And so I read an article on her blog talking about pelvic health and about how people think of the pelvis as the pelvic floor. The small number of muscles, it's a pretty big number of muscles, but compared to the whole body, the small number of muscles make up the pelvic floor. Whereas the pelvis is actually a hugely complicated part of the body. It has multiple organs. It's made up of lots of different kinds of muscle and fascia, different tissues, and it has the conjunction or the splitting, depending on what direction you're going in, of some of the biggest veins and arteries in the body, right? All of the blood flow to and from the legs. The legs need a lot of blood because they're holding us up all day long. And also the legs are reasonably complicated in terms of the venous return, in terms of how blood gets back up from them, because it's both working against gravity and without a lot of push from the heart once the blood gets that far away from the heart all the way down into the toes. So hugely complicated in terms of the circulation. And so I don't remember enough of the specifics of the article to tell you exactly how it all works. But basically, when we don't have enough blood flow, or we don't have healthy and full circulating blood flow coming up from the legs through the hips into the pelvis, then the uterus isn't getting the right sort of nourishment by the blood, and we're more likely to get cramps, which is why Kathy has an entire article about how you need to move your legs more and exercise and do stretches and open up your hip joint in order to treat PMS. So definitely worth checking that article out. Again, especially if you have PMS, cramps, any sort, or even any sort of fertility issue, or you're pregnant. Basically, if you have a uterus or a pelvis, even if you don't have a uterus, worth checking out. And the other day, I was at a friend's house, and her daughter, teenage daughter, was having cramps and asked if I could do some acupressure. And then she's like, why do these points on the inside of my shin help with the cramping? And I started to say, well, I know how to explain it in Chinese terms, but I don't know physiologically what's going on. Then I said, wait a minute. These points, these spleen points, affect blood flow and muscles in the legs and the uterus. Maybe if we're improving blood flow in the big muscles of the legs, using these points that are located in the big muscles in the legs near a lot of veins, we're improving the blood circulation in and around the uterus, and that's how we're treating the cramps, because lack of nourishment by the blood definitely causes cramping in muscles all over the body. Don't see why the uterus should be any different. And so I was just suddenly struck again, like I was talking last week, about how sometimes just understanding not even necessarily how something works, but that something can work in the systems to which we're used to, the systems that we're used to using, helps us be able to adopt things that otherwise we might have a resistance to. So that was one thing I was thinking about. The other thing I was thinking about is how totally disconnected from our bodies we are. I'm used to people saying, but why does my leg affect my back? Why is my shoulder connected to my knee, despite the fact that you're like one big body all put together from muscles and tendons that are all connected to each other and bones. And if you were to look at a model made out of rubber bands representing all of your muscles on popsicle sticks representing your bones, you would really easily see that like literally every part of your body is connected to every other part of your body. But that throughout all the years that people have been using Chinese medicine, trying to explain Chinese medicine, trying to understand Chinese medicine, no one was able to stop and say, wait a minute, maybe, so we're confused about why points in the legs affect the uterus, but it's not too big a leap to understand how points that affect blood flow and circulation in the lower half of the body would affect the uterus. There's that just kind of disconnect, that misunderstanding, that we don't make these leaps to, if something works, then maybe there is an explanation and it's worth looking for the explanation. And also that one thing affects something else when we've placed them in different artificial categories, circulation versus muscles, or gynecology versus orthopedics versus whoever does veins in the legs. That's going to bug me now. I should look that up. But anyway, we kind of divide the body into chunks, and we divide our lives into these different chunks. Then we don't look for how one part affects another. So we're going to take this into the more psychological, emotional aspect, like people who, I had a stressful day at work, but I left work. So why do I feel like yelling at my friends when we go out for drinks in the evening and they're being a little annoying? We really artificially divide everything both inside ourselves and outside of ourselves, and then have difficulty understanding why, not even how, but why one thing would affect another thing. So there, I still don't think I actually reached a theme for this video, but I think it helped me talking through it. I hope it helped you and interested you. And again, if you're dealing with basically any issues related to having a body, look up Katie Bowman, Move Your DNA, check out her blog. There's an article in there about pelvic health and menstrual cramps. It's probably called something like pelvic health and menstrual cramps. And have a great day.